152/94. Most people see this number and think, I need medication. Don't panic, because the reading on the blood pressure machine could be wrong. And as a board-certified cardiologist, I've seen the terrible side effects in patients who started the blood pressure medications they may not have needed. So before you start medication or before your dose gets increased, I'm going to show you 10 blood pressure mistakes that can fool you, your machine, and sometimes even your doctor. And mistake number 10 happens before the cuff even starts squeezing. Let's count them down. You sit down, you put on the cuff, you press start, and suddenly your blood pressure looks terrible. But the problem may not be your heart, it may be your bladder. A full bladder can trigger a fight or flight response that can tighten your blood vessels and push your blood pressure higher, sometimes by more than 30 points. Think about it. A normal reading of 122 could suddenly look like 152. And now you're scared, your doctor is concerned, and the number that was never real may end up in your chart. That is why this mistake is so dangerous. Simple rule: bathroom first, blood pressure second. Don't let your bladder write your prescription. And mistake number 9, this one happens while the cuff is squeezing, and almost everyone has done it. You wake up, you drink your coffee, maybe you smoke. You should, but anyhow. Maybe you take the dog for a brisk 20-minute walk. Then you come back, you sit down and check your blood pressure. Sounds harmless, but that number may be falsely high. Why? Because coffee, nicotine, even a brisk 20-minute walk, any form of exercise can push your blood pressure up for a while. So if you check it too soon, you're not measuring your true blood pressure. You are measuring your body's in stress mode. And that can make a normal number look dangerous. Here's the rule: no coffee, no nicotine, no brisk walking, no exercise. Wait 30 minutes at least, because you want the true blood pressure, not your stress blood pressure. Don't measure your coffee, don't measure your nicotine, measure your blood pressure. And mistake number 8 is one of the easiest to fix, but almost nobody does it right. This happens quite often. You just walked in, you were running late, you were stressed. Maybe you're rushing from the parking lot to your doctor's office. Maybe you were still catching your breath. Then you sit down, they wrap the cuff and they press start, and boom, your blood pressure looks high. But that may not be your real blood pressure. That may be a fake blood pressure. Your body needs time to switch from the go mode to the rest mode. And if you check too soon, the machine may be measuring your stress, not your true blood pressure. Here's the rule: before anyone checks your blood pressure, sit quiet for 5 full minutes. No talking, no phone, no tensing shoulder. Just sit and relax. Because sometimes the difference between a scary number and the true number is not another pill. It's 5 quiet minutes. Here is number 7. You did everything right. You waited, you stayed quiet, you avoided coffee, but your blood pressure still looks high. Now look at your body. Are your legs crossed? Is your back unsupported? Are your feet dangling? That may not feel like a big deal, but to the blood pressure machine it is. Your posture can quite push your numbers higher. And the scary part, you may never realize that it's happening. Crossed legs can raise your reading. Unsupported back, dangling feet can all raise it too. Now stack 2 or 3 of these together and the perfectly normal blood pressure reading can suddenly look like a problem. So here's the setup. Feet flat, back supported, and legs uncrossed. Bad posture can make a good number look bad. That's how you stop your posture from lying to the machine. But there is one posture mistake so important, it deserves its own spot. And that is mistake number 6. And this one looks harmless. You sit down, the cuff is on, the machine starts, but your arm is hanging to your side or resting on your lap, or you're holding it up. That can ruin the reading. Why? Because your blood pressure changes depending on the position of your arm. If your arm is too low, the number can look falsely high. If the arm is too high, and the number can look falsely low. Now, the machine is not just reading your blood pressure, it's reading your effort as well. So the cuff should read your blood pressure, not your arm. Here's the fix. Rest your arm on a table or a pillow, relaxed. The cuff should be at the heart level, because a dangling arm could turn a normal number into a scary one, and most people never realize their arm was the problem. This is a tricky one. The cuff is on, you're sitting still, the machine starts squeezing, but your mind is not still. Maybe you're talking, maybe you're watching TV, maybe you're scrolling on your phone, maybe you're staring at the numbers thinking, please don't be high. That can throw off the reading, because your blood pressure doesn't only respond to your body, it responds to your mind. So your mouth may be quiet, but your brain may still be loud. So even if your arm is still, your blood pressure may not be resting. Here's the rule. While taking your blood pressure, your body and your mind need to be relaxed. No talking, no TV, no phone, no scrolling. Because what matters is not just the number. It's what your mind was doing while the machine was measuring it. And here is the cuff that lies. You may be sitting perfectly well, your arm in good position. You may be calm and quiet. But if the cuff is the wrong size, the number could still be wrong. And this mistake is easy to miss. If the cuff is too small, it squeezes your arm hard and your blood pressure can look falsely high. If the cuff is too large, the opposite can happen and your blood pressure can look falsely low. So one cuff can scare you, the other cuff fools you. And both can lead to bad decisions. And this is especially important if you have a very large arm or a very thin arm, or if you bought a home blood pressure machine that comes just with one cuff. Here's the rule. Before you trust the numbers, check the cuff. Wrap a measuring tape around the middle of your bare upper arm. Then look at the size range printed on the cuff. Your arm needs to fit that range. And here's mistake number 3, is one that people do at home all the time because they think they're being more accurate. This is the sleeve trap. You are in a hurry, you keep your shirt on, you slide the cuff over a sleeve, or worse, over a sweater, and you think, close enough. No, a cuff is not supposed to squeeze your clothes. It's supposed to squeeze your arm. If there is a fabric between the cuff and the skin, the machine can get fooled. Even a thin shirt can throw off the reading. And I think sweater obviously even worse. And here's my mistake, rolling up a tight sleeve. That's a no-no. If the sleeve bunches up, it squeezes your upper arm, and now you've made a little tourniquet before the cuff even starts. So here's the rule, bare arm only. Place the cuff on your skin about 1 inch above the bend of your elbow. No sleeve under the cuff, no tight rolled up sleeves, because the cuff needs to read your artery, not your clothing. Bare skin gives you the real number. Here's mistake number 2. Checking the same arm every time without ever checking the other arm. Most people have a favorite arm. Maybe it's easier, maybe the cuff fits better for whatever reason. But here's the problem. Your left arm and your right arm may not give you the same number. A small difference is common, but sometimes one arm is constantly higher. And if you only check the lower arm, your blood pressure may look better than it really is. Here is the rule. When you start checking your blood pressure, do at least once in both arms. If one arm is consistently higher, that becomes your blood pressure arm. Do not choose the lower number just because it feels better. Use the arm that tells the truth, the higher number. And here's something you want to know. If the difference between both arms is more than 10 points or 15 points, you need to tell your doctor, because that may signal that you may have blockage in the arteries going to one of your arms. Here is the biggest one. You check your blood pressure once. You see a high number, and now that one number takes over. But here's what most people forget. Blood pressure moves all day long. If it is usually lowest while you sleep, then raises just before you wake up, and it's higher in the afternoon. So if you check your blood pressure at 7 o'clock in the morning and you check your blood pressure at 7 p.m. next day, you're not comparing apples to apples. Here is the rule. Use the same arm, same time of the day, and the same setup. And don't just do one reading. A pattern, it's what tells you the truth. Here's what you should do. Take one reading. Wait a minute or two. Take a second reading. If the first reading was much higher than the second one, take a third one and average the last two. That will give you an accurate blood pressure number. Because remember, blood pressure is not a fixed number. It's a moving target. So we went over 10 common mistakes that people make taking blood pressure. Why bother? Why go through all of these steps just to check your blood pressure? If your measure is wrong, you may be treated wrong. And a falsely high number can get you labeled with high blood pressure and put you on a pill you may never need it. But a falsely low number, on the other hand, can even be worse. Now you think you're safe while your blood pressure is still putting you at risk for a stroke or heart attack or kidney failure. So the goal is not to get the lowest number. The goal is to get the true number. This is about getting the truth before you make decisions. Measure it right. Find your real pattern. Treat the real blood pressure, not the fake number. But what if your true blood pressure is high? That is where the next video comes in. In that video, I'll show you a simple breathing technique that can lower your blood pressure in seconds. No pills, no equipment, just your breathing. Check the video, Lower Your Blood Pressure in Seconds. I'll put a link above and the description below. Don't let the bad reading scare you. And don't let the real high reading go ignored. And always remember, your health, your most precious asset. Take control. See you in the next video.